20% are imported, 80% are local cases. Among the 223 cases contracted locally, 30% are untraceable. It shows that we still have a transmission chain in the community. And also we have the gene cluster outbreak. The epidemic situation is seeing a rebound. We have commissioned Professor Gabriel Leung from the HKU to investigate the effective reproduction rates. Because of the outbreak, the reproduction rate is now 1.7, which means that for each case, 1.7 people will get infected. The local epidemic situation is very serious. Concerning the Ursus Fitness Center cluster, I would like to tell you some latest updates. Among the 15 local cases with epidemiological links, 13 are linked with the fitness center cluster. So far, there are already 120 cases from this cluster. Through rapid and stringent contact tracing as well as quarantine, 860 close contacts are undergoing quarantine in our quarantine centers. We have required more than 2,200 household members of close contacts to undergo compulsory testing. As yesterday, concerning the gene cluster, we have already issued compulsory testing notices to more than 180 buildings and working places. In terms of gene sequencing, for all cases contracted in Hong Kong, we would conduct gene screening for these cases to make sure that no virus strains and variants have been imported to Hong Kong. Concerning the samples from this cluster, according to our gene screening exercise, there are no variants of, there are no mutation of virus. In the past 2 days, we have invoked CAP 599J compulsory testing against certain persons to issue restrictions and testing notices as well as compulsory testing notices to many buildings in the central and western area. Since 7 p.m., the restricted area on mid-levels have been given the restricted and testing notice. The dynasty courts, some 900 people have been tested. We have identified 2 cases from the area, and another 2 samples are being processed. Now let me brief you on our control measures concerning the gene cluster. According to our epidemiological investigation, we have identified several risks. For many patients, they have not adopted sufficient personal protective measures during exercising. For example, they did not wear a mask during exercising, and also they did not maintain proper social distancing. They gathered in these activities. So we would like to make an appeal to members of the public. Please bear in mind that in the light of the epidemic, in indoor areas, you have to wear a mask and clean your hands and maintain social distances. Secondly, in the light of the situation, we have tightened the measures, the requirements for wearing masks in gyms, which we have mentioned in our press release. Thirdly, concerning all household members of close contacts, as well as buildings with confirmed cases and workplaces where patients work, we have issued compulsory testing notices. a round of compulsory testing has been completed. However, we would monitor the situation closely. If there are more cases surfacing, then we may do another round of compulsory tests. On top of that, in the light of the rebounds of the situation, we would like to urge members of the public to join the vaccination program if you belong to priority groups. Eligible citizens should be vaccinated for your own sake and your family members' sake. Previously, the two secretaries have announced that the priority group for vaccination has been extended. The benefits outweighs the risk. That's why we urge members of the public to protect yourself by getting vaccinated to stem further spreading of the disease. Now I would like to invite Dr. Albert to tell us the details of the cases. Thank you, Dr. Lam. Yesterday we have confirmed 30 cases. The case numbers are 11283 to 11312, involving 17 males and 17 females. They are aged between 17 to 81. 2 cases are identified through community testing centers. Among the 14 imported cases, 5 came to Hong Kong on CX906 on the 13th of March. These 5 patients came from the Philippines. All 5 are foreign domestic helpers, and there are another 5 foreign domestic helpers. 2 came to Hong Kong on 5J7272, arriving in Hong Kong on the 13th of March from the Philippines. 1 patient arrived on PR330 on the 13th of March. 1 was on 5J272, arriving at Hong Kong on the 2nd of March from the Philippines. She was tested positive on the 12th day in hotel. The last case involving foreign domestic helper is a domestic helper from Indonesia. She came to Hong Kong on PR980 on the 13th of March. The remaining 4 imported cases include 1 case from Togo on QR818 on the 1st of March. The other one is from Bengal on SQ8H2 on the 3rd of March. Both cases were tested positive on the 10th day. The other 2 cases are from Pakistan on EK384 on in March. Among the 14 imported cases, we have completed the initial gene screening and found that 12 cases carry N501Y mutant variant, including 9 cases from the Philippines, 2 from Pakistan, and 1 from Bengal. So far, 87 cases have been found with the variant, including 37 from the UK, 8 of the South African variants, and 5 from Brazil. 37 are yet to be analyzed. There is also 1 untraceable case today, which was mentioned yesterday. An 81-year-old elderly person who resides in Pine Care Tak Fung Elderly Care Center in Lai Chi Kok. The patient resides on the 2nd floor, so the 28 residents on the 2nd floor have been sent to the AWE for quarantine. Another 16 staff members who are close contacts have been quarantined as well. The remaining 15 cases have links with previous cases involving 13 relating to the URSS cluster, including 4 URSS customers and 9 close contacts of URSS customers. So far, there are already 122 cases in the cluster, 7 staff members, 85 customers, and 30 close contacts. Preliminary positive cases are involved to the cluster as well. Today, another 6 buildings have been identified as cases relating to the cluster,
including the Borat mentions on Owen Road, and also number 14 Triganta Tower 1, and the Harbor View, and the Sun Xing Mansion on Madam West Street, the Grand Austin, Block 3, Tsim Sha Tsui, and the Olams Court, 419 to 419R to 419T, Queens Road West, and also the Kemsing Building in Devoro Central. So far, we have recorded more than 10 preliminary positive cases, including 2 preliminary positive cases where the patients live on the Dynasty Tower, and they were identified during the operation last night, involving one male, 40-year-old male, and one 41-year-old female. Both are residents living on the third Block 3 of the Dynasty Tower, and they work in the consular office. And the last day of work was the 12th of March. Both are asymptomatic, and they were found out during the quarantine period. So we are now conducting contact tracing, and we are now liaising with the American Consulate Office to find out who are the colleagues at the consulate office who need to be tested, and that the consulate office will need to be thoroughly cleansed, and if there are any affected persons, they will need to be sent to the quarantine center. There are also 2 earlier cases, including one from Block 2 and another one from Block 4. We have another preliminary confirmed case which is untraceable, involving a 38-year-old male who works in the ITAS International Company, ICAS. He is a computer engineer. His place of work is actually the Hong Kong Bank building. He works on the 27th floor. Last day of work was the 12th of March, and symptoms developed on the 10th of March. And since the company asked him to take the test, and he was found positive. He lives on number 16 and number 18 of Tai Hang Road. So we are conducting epidemiological investigation on this case at the moment. Dr. Ho? As of 9 a.m. this morning, during the last 24 hours, the HA system reported a total of 40 cases. We have 14 confirmed cases who have been discharged. So far, we have 10,769 patients who have been recovered and discharged. As at 9 a.m. this morning, 279 confirmed cases are staying in 20 of the public hospitals and the North Lantau Hospital, the Hong Kong Quarantine Control Center. 13 are in critical conditions, 10 serious, and 256 patients in stable condition. Number of negative pressure beds, it's 1,184, usage rate 58%. Negative pressure ward, 648, usage rate 60%. That's all for my report. It's now Q&A time. Please give us a name before you put your question. Lady on the 3rd row. Good afternoon, I'm from the Apple Daily. Regarding the Ursus Fitness Center, in a press interview, the proprietor claimed that the source of the infection was actually the Guiyuan court next door because they washed their laundry or towels at the laundry shop there. Have you now found the source of the epidemic? Have you also investigated into this Guiyuan court? Yesterday, there was a minor outbreak at the school yesterday. The fine art teacher was preliminarily confirmed yesterday. Is he now an officially confirmed case? The school, in response to media inquiry, said that they suspect that one of the part-time staff has also been infected. Have you followed up on that? Regarding the Ursus cluster, we have recorded one case where where in the Guiyang court there is a unit in which there is a case. There are 4 cases involving one family. Case number is 11604. So this is an untraceable case. Underneath the Guiyang court there is a laundromat. And we understand that some of the Ursus customers would take the towels there for cleaning. There are 2 staff at this laundry shop who had also gone to the Ursus, so they are close contacts and we've sent them to the quarantine center. We've also asked family living in the Guiyang court. They have not actually patronized the laundry shop, so our epidemiological investigation is still ongoing. So far, we have not found any connection between the Ursus cluster and these cases in the Guiyang court. But we will arrange for DNA screening for the family cluster and the Ursus cluster to see whether or not they are related. Regarding the fine art teacher, I think he is now a confirmed case. The Harbour School, there used to be a part-time worker who worked in different premises. He's not a full-time staff, but he has been to that school, but he is not someone working in the IT room of that school. Next. Last row, question in English.
SCMP. Why is there a delay in issuing guidelines regarding people with vulnerable conditions about whether or not they should take the jabs? Since without the guideline, how will people address the confusions among doctors, and how should they advise their patients? Or the fear, since there is a fear amongst the public about whether or not they should take the jabs. So why is there a delay in issuing the guidelines? This is my first question. My second question is whether the CHP could clarify under the current procedures whether parents can accompany children who need quarantine or need to be sent for treatments in hospitals. My third question is how many schools in total have been affected because of the Ursus cluster? And my last question is, since today there are many cases from the Philippines, will there be another flight ban for Cathay Pacific? Thank you.
Okay, regarding your first question, indeed, the fact sheets we issued, as including also the package inserts for the 2 vaccines in use, have very clearly listed out the contraindications as well as the precautions for different clinical conditions that the healthcare professionals can be aware of in treating or managing their patients or those who want to receive vaccinations. And secondly, indeed, starting from the end of February, we have been actively in discussion with the specialty colleges as well as the academy on how to develop and formulate the guidance for the healthcare professionals to follow in managing or responding to the questions from those who wish to receive vaccines with various clinical conditions. So the latest development is that we will shortly upload the guidelines today to our dedicated website. This is number one. And secondly, within the guideline, we have provided quite general and generic principles on what conditions the healthcare professionals have to watch out for, especially for patients with chronic diseases. So, in our discussion with various specialists, experts, and various specialty colleges, we noted their concerns that it is very difficult, or there is, in fact, is not sufficient evidence to substantiate certain, concrete parameters or values that they can use to advise the patients whether or not they should receive the COVID vaccines. Take the example. Maybe I call the HbA1c, which is an indicator used to monitor the diabetes mellitus status of the patient. So when there is a certain value, they know that what value they should achieve in order to maintain the good diabetic management. However, with the change in ages and with other comorbid conditions, the HbA1c, the target, they may need to adjust for various patients with different clinical conditions. As such, it is very, very difficult for the experts to define a very concrete value beyond which or below which they should or should not receive vaccines. So we could only provide general principles so that at least the healthcare professionals, they know how to make independent assessment based on these principles. The guideline, or I would say the interim guidance notes, will be uploaded today.
下一位我哋答多個英文問題，第三行嗰邊第三。
Let's take another English question. The lady in the first row.
RTHKs, just to want to follow up on the consulate workers, could you tell us the job nature of these two preliminary patients? Do they interact with the public? And secondly, are they currently in hospital or being quarantined? Or because some reports say that they have refused to be quarantined because of their job nature. And also, I'd like to ask if the CHP or the Department of Health is tracing the close contacts of these two workers, because according to a statement issued by the consulate, it seems they are doing the contact tracing on their own. So are they being cooperative with the authorities? That's it. Thank you.
Thank you for your question. For the two preliminary positive case affecting two staff of the United States Consulate Office in Hong Kong, we have liaised with the Consulate General to carry out further investigation and also contact tracing for these two cases. As they are preliminary positive, as our usual practice, we will arrange both cases to be admitted to hospitals for isolation, and also the CHP will issue current isolation order for the two cases. As far as we understand, they are working in the U.S. consulate as office staff, but for the exact job nature of these two persons, we are still liaising with the U.S. Consul General to understand more about their job nature. And we will also arrange the household contact of these two cases admitted to the hospitals for testings and also for quarantine. Apparently, they have not visited any gym during the incubation period, so the source is still unknown and we are still investigating. Up to today, we have advised 7 schools to close related to the ursus clusters.
下一位呢邊呢度第三行呢位。
Next question, the gentleman, the lady in the denim. Hi, I'm from Hong Kong 01. About the consulates. The two preliminary positive cases, when did they arrive at Hong Kong? Are they counted towards local cases? Also, on arrival, were the quarantine waived? Did they produce a negative test results? Were they exempted? And also about the dynasty court, is that the hostel, or are there any other consulate staff who need to be quarantined? What activities did they engage in? I mean, the two preliminary cases. And also, do we have a truck driver who has been given Sinovac jab who is experiencing a facial paralysis? Is there any preliminary conclusion whether it is related to the vaccination? And also, yesterday, you mentioned a staff working a barista working in a cafe was inconclusive. So is he confirmed right now? Concerning the 2 preliminary cases working in the U.S. consulate office, we have been conducting investigation, and we are trying to find out where they have been to and who they have come into contact with in the past 14 days. We have been liaising with the consulates to see whether there are any close contacts in their workplace. It seems that they are office and staff, and they have been wearing masks during work. We are still trying to find out whether there are any close contacts in the office. The investigation is still ongoing. They will be arranged for quarantine and treatments in hospital. They have no symptoms. They were tested preliminary positive yesterday. In the past 14 days, they mainly went to work and visited restaurants and supermarkets. More recently, on the 10th of March, they have been to a bar on Staunton Street. The name is Stretchen Nobella. Both of them have been to the bar. On the 3rd of March, they have been to a restaurant called Bone and Grace in Sai Kung. Otherwise, they mainly stayed at home. I don't know whether the Dynasty Court flags are their boarding places or what. So we are trying to follow it up with the consulates. Concerning vaccination, if there are any clinical events, we would refer them to the expert committee on assessments of clinical events following inoculation, according to our mechanism. As far as I know, the committee is reviewing these first events. Next question, please. The lady in the middle. Hi, I'm from Mingpao Daily. About the 2 preliminary cases from the U.S. Consulate's office, did they arrive at Hong Kong just recently, or have they been residing in Hong Kong? And also, there have been reports that they have refused to be sent to hospital. Is that right? Does the U.S. consulate staff have the right to exercise exemption to be exempted from 599 regulations? Is that a loophole? And also, will the U.S. consulate office be subject to compulsory testing? And also, we have a preliminary positive computer staff working in the headquarters of HSBC. We have seen 2 cases from the HSBC headquarters already previously. So is this new case linked to the previous cases? Third question, the 81-year-old elderly home residents who did not go out, according to Dr. Au. It turns out on the 25th of February, the son of the old gentleman went to Kwong Wai Hospital with the patients on the 25th of February. So do you need to do any contact tracing in Kwong Wai Hospital? 3 questions. First, about the consulate cases. The 2 patients arrived at Hong Kong in September last year. So they are definitely local cases. They have not left Hong Kong recently. They should be exempted persons. I don't know the details though. If they are indeed confirmed, the U.S. Consulate office in Hong Kong, just like other workplaces with infections, will be subject to compulsory testing. So all consulate staff will be subject to compulsory tests. The second question is about the preliminary positive case involving the computer, the IT staff. He's a staff under a contractor. However, he works on the 27th floor of the HSBC headquarters. He has not been to other floors. However, he would have lunch in the canteen in the headquarters. He did not have contacts with others. His onset was on the 10th of March. Previously, the 2 cases, one worked on the 17th floor and the other one worked on the 22nd floor. The new preliminary case does not know the other cases. from the face of it, there is no direct epidemiological linkages. There are many people working in the headquarters, so it is not surprising to find more cases. Concerning the 81-year-old elderly care home resident, the son is a close contact. After onset, he went to Cornwall Hospital with the patient. Concerning the 25th of February, it was already outside the incubation period, so the source of infection was not the visit to Cornwall Hospital on the 25th. We will try to find the antibodies as well as the clinical condition of the patients to see what the source was.
Sorry, the speaker's not coming through. Let me try to answer that question. I think if you have been paying attention, the U.S. Consulate Office has already issued a statement on their website saying that they will fully cooperate with the government in terms of our, anti-pandemic efforts. Now, TV, Dr. Lau, regarding the guidelines for vaccination, is it that today you will be making some announcements for the private medical practitioners? And in the guidelines, will there be any objective indicators? For example, the numbers regarding the blood sugar level and so on. And also regarding the patients with facial paralysis. Is it true that we have, a cross-border truck driver who has suffered from facial, distortion after vaccination? Why is it that you do not make an immediate announcement? You would only announce such cases a few days after it has happened. In announcing such adverse events, what is the guideline? Why is it that early on we learned that there were more than 70 adverse events, but not all of them were reported on the same day? And also regarding the two U.S. consulate consulate cases, have they refused to be hospitalized? In the course of taking them to hospitals, have they resisted? And also regarding the patients working at the HSBC building, have they been, other than going to the canteen, have they been also to the other floors where there have been earlier, where there have been some earlier confirmed cases? Today, we will be issuing guidelines to the frontline, medical practitioners in respect of patients with chronic diseases. That is, if they wish to be vaccinated, how should the doctor advise them? So we will put on to our website such the guidelines to advise the doctors. When we began the vaccination program at the end of February, we have been closely in touch or liaising with the various specialist colleges. In working out these principles, we had deliberated on whether or not we should put some hard indicators in the guidelines. And the experts have told us that if we adopt some hard indicators to determine whether or not someone should be vaccinated, there is actually no sufficient scientific evidence to support that. For example, if you use the blood sugar level as an indicator, now the condition may vary depending on the age of the patient. So in the absence of scientific evidence to help us set up these hard indicators, we believe that it is most appropriate that we would, spell out the principles for the medical practitioners and for the doctors to judge who are the people who shouldn't take the vaccine, or who are those who need to have their conditions cured or remedied first before they take the vaccine. So we will first of all put the broad principles onto our website. As the next step, we are still continuing with our discussion with the experts. When it comes down to details such as whether or not a person has, for example, earlier on had some organ transplant or are receiving some form of treatment. And in these cases, whether it is suitable for them to be vaccinated. We're still deliberating with the professionals on these points to see whether or not we can spell out finer details, under those broad principles. Secondly, regarding the safety surveillance of the whole vaccination program, we have different expert panels and and committees, and they've all confirmed that the benefits of vaccination exceed the risk. And secondly, we understand that when a large number of people are being vaccinated, inevitably with a large base, as more people get vaccinated, naturally there will be also more adverse events. What is important is that once we receive reports of these adverse events, the mechanism will need to be sound. We have to look into each and every case and see whether or not they are linked to the vaccines. And in each and every case, we'll look at I think it will be most appropriate to refer it to the independent experts to make a judgment. The COVID-19, the expert panel on adverse events are now meeting today. They will look at the relevant cases, so they will be the gatekeeper. And if there's any untoward events, they will be able to find that. And the report last week also could not establish any causal relationship. And for your information, now, globally, different countries are now going ahead with vaccination. Israel has the highest vaccination rate, and they've just published finding of a report covering 1 million people, and the study showed that the vaccine can effectively cut down the onset rate and the hospitalization rate of patients, and also the mortality rate. In the UK, a study involving a large number of elderly persons showed that vaccinating elderlies over the age of 70 can help relieve the severity of the disease and also lower the mortality rate. In Hong Kong, we have more than 11,000 cases. We have more than 200 people who have died because of the pandemic, most of them elderly persons. Like other parts of the world, the elderly are the most affected. When we have an effective vaccine available and the clinical data show that they are safe, and if vaccinated, definitely the benefit will outweigh the risks. Of course, we understand the public's concern, and because of that, we need to have a good surveillance system in place. I think many of the reports we have received show that the surveillance system is very sensitive, and our expert panel will not, be let off their guard. All the experts will make independent assessment of all the relevant cases. If you look at our press releases we issue every day, you find that we are very transparent. For example, how many people have experienced discomfort after vaccination. All such details we are fully disclosed.
關於美國領事館
Concerning the 2 cases from the U.S. U.S. Consulate office, we have arranged them to check into public hospital for isolation and treatment. Normally, when a case is confirmed or preliminary confirmed under Cap 599A of our law, the case must be isolated in hospital and receive treatment. In dealing with 2 cases, we have followed the usual practice. We have been carrying out epidemiological investigation, and we have arranged isolation bed place for these 2 patients with DHA. We were only alerted about these two cases this morning. They are a couple, and they are both confirmed. If there are family members requiring care at home, more time will be needed to arrange for quarantine. Normally, when the parents are confirmed to be patients and there are young children who need to be taken care of, then we will try to find family members in the household who can take care of these young children when the parents are undergoing quarantine. For cases with special circumstances, for example, if no one is available to take care of the children, and if the mother needs to breastfeed her child, then we would evaluate the risk. If the close contact has already spent a considerable period of time with the patients and might have been exposed to virus already, then we would liaise with the HA to arrange for the ward to check into the hospital with the carer. Next question, the lady in the back. Good afternoon, doctors. I'm from Hong Kong Economic Times. The two preliminary positive cases from the U.S. consulate, how many close contacts are there? Are there any close contacts beyond their workplace during other activities? And also, the 20-year-old female barrister announced yesterday she was not confirmed as a case yesterday. So what is the situation today? It seems that we have lots of imported cases today. What's the reason? Thank you. Concerning the preliminary cases from the U.S. Consulate Office, we are still conducting investigation. So far, 3 close contacts have been identified who are household members of the patients. 2 will be arranged for quarantine in the hospital. The other one will be sent to a quarantine center. For close contacts in the workplace or venues which they have visited during the incubation period, we are still investigating. Mostly, the couple went out to have meals and so on, and there are possibly more close contacts in the workplace. We are liaising with the U.S. consulate to see to that. Concerning the barrister, the sample was inconclusive, so we have arranged for her to check into a hospital for tests. She is not a preliminary positive case yet. The situation is changing. The reporter asked why there were more imported cases. According to WHO, globally, there are additional 2.7 million more cases. Compared with the week before, the trend is on the rise. One reason is the virus variant. There are several types from the UK, South Africa, and Brazil. For some viral strains, it is confirmed that the infection rate is higher than other strains. It may have contributed to the rising number of cases globally. It is also the reason why we want to expand the scope of vaccination in Hong Kong. According to the studies that I mentioned, it has been shown that mass inoculation is effective in protecting the patients to avoid to reduce the severeness of the disease and also lower the mortality rates. If the inoculation rate can be raised, Hong Kong can be better protected. Next question, the lady over there. Hi, I'm from Cable News. About the 2 cases from the U.S. consulate, are there anyone living with them? If they are indeed confirmed, then their workplace will be subject to a compulsory testing notice. How many people will be involved? When can it be done? And about the IT engineer, did he come into contact with people outside his workplace? For example, what kind of what is his job nature, and will the entire HSBC headquarters building be subject to testing? Concerning the 2 cases from the US consulate, there are 3 close contacts who are all living with the patients. This is what we can find so far. We cannot rule out the possibility of more close contacts. Yes, if they are confirmed, all staff at the US consulate office will be subject to tests. Concerning the number, we will work it out with the consulate. About the IT engineer working in HSBC building, he works on the 27th floor. Previously, in the headquarters, there were 2 cases from 2 other floors, on the 17th floor and the 22nd floor. So far, there are already 3 cases in that building. The previous 2 cases are related to the Ursus cluster. The new case, however, has not been to GEM or Ursus. There are multiple cases in the same building, so we will subject HSBC headquarters building to compulsory testing. We are still finding out the close contacts. During the incubation period, he has visited different restaurants. Those who have had meals with him will be listed as close contacts. I don't have the number so far. Sorry, the speaker is not using the mic. No. Next, the gentleman. Hello, I'm from AM 730. You said there's one confirmed fine arts teacher from the Harvard School. What is the case number? What about the part-time worker confirmed before? And what does he do in this school? Concerning preliminary positive cases, the 2 workers in US consulate do not have symptoms. So which one would be counted as untraceable? For the 27th floor office of the IT engineer, how many colleagues will be quarantined? From the restricted area, one sample is inconclusive, so can you give us more on that? Dr. Lam mentioned that for some fitness centers, the gym goers did not maintain proper social distancing, which led to the outbreak. So how many cases are involved? Were expatriates involved? And can you give us more? The fine arts teacher confirmed, preliminary confirmed yesterday, is confirmed today, is 11296. And also there is a part-time teacher in Harvard School. The case number should be sorry, I don't have the info right now. Let me give you the information later. For the IT engineer, we are investigating the case. Normally, in the workplace, those colleagues sitting close to the patients might not have worn a mask and might have chatted with the patients and might have had meals with the patients. These will be listed as close contacts. We are still tracing them. If there are no more questions, this is the end of the media briefing. Sorry, the speaker is not using the mic.
Well, that was eventually confirmed to be a negative case. Thank you very much. That's the end of our briefing.